Hello, my name is Imani Bryan, and I am here with Jamie Barth, and we are discussing stigmas, discriminations, and healthcare disparities. When we talk about LGBT disparities, we must also recognize the layered impact of intersectionality. That means understanding how a person's race, income, or disability intersects with their sexual orientation or gender identity. For instance, if a queer immigrant may struggle not just with stigma, but also with language barriers and documentation issues, these overlapping challenges magnify their risk for poor health outcomes. As providers, we must adopt an intersectional lens in care planning, advocacy, and policy reform to make true health equity possible. Trauma is a silent thread running through many LGBTQ lives, whether that they experience bullying, family rejection, or hate crimes. A trauma-informed approach ensures that we aren't just treating symptoms, but we're supporting their healing process. This means creating safe spaces, honoring pronouns, and listening without judgment. When LGBT patients feel safe and respected, they're more likely to seek help, stick with treatment, and thrive. Trauma informed care isn't optional, it's essential to be inclusive and provide compassionate healthcare. LGBT youth face disproportionate mental health risk, and schools can either be a lifeline or a danger zone where they've experienced either the first support in their life or they experience harm for the first time. When proper training of school staff, with proper training of school staff, um, these schools can become safe zones for these youth. School-based interventions such as inclusive curriculums, pronoun respect, and early mental health screenings can change the trajectory of a young person's life. Our advocacy must extend beyond just the clinic. It has to go into the classroom, school boards, and education policy. The future of LGBTQ healthcare lies in policy reform and innovation. Laws really matter. States that have gender affirming policies have better health, mental and physical health outcomes amongst the LGBTQ population. Tech-based models, including telehealth, can also help to reduce these care gaps, especially in rural areas. However, innovation must be equity driven, not just convenience driven. It's on us to ensure policies and systems truly meet the needs of all LGBTQ individuals, now and in the future. To close care gaps long term, we must also train the next generation of LGBTQ affirming providers. That means and including this type of content into the core curriculum, not just as electives or workshops. Beyond terminology, uh, medical uh, uh, medical and nursing students must need to understand the lived experience, barriers to care, and how to communicate with humility and empathy. You have to do simulations that actually include real life actors who are part of the LGBTQ community and use real life case studies. These are both powerful. These are powerful tools that will help to build confidence and competence. This is how we build a workforce that not only affirms but does not alienate. LGBTQ individuals are also more likely to trust people who share their experience. That's why having community-led models matter. From peer navigators to community health workers who guide clients through insurance and hormone therapy, and access to care, to LGBTQ centers offering mental health support. These type of networks help to bridge the gap between clinical care and the lived experience of LGBTQ individuals. Providers should not operate in silos. It's upon us to partner with these organizations to meet people where they are and to co-create solutions that give up and to co-create these solutions.
Hi there, this is Jamie, and I will be presenting this slide. So discrimination in the LGBT community. So discrimination occurs in the community when a negative experience comes about due to a person's sexual orientation or gender identity. So these are manifested in actions that are, for example, bullying, harassment, violence, prejudgments, or any other negative barriers or actions that can occur perhaps in healthcare and employment. So specifically for healthcare, for this presentation, we have examples of refusal of care, misgendering, or inadequate care for those who are in participate in the LGBTQ community. Stigmas are negative societal beliefs that lead to marginalization or shame of a certain community group or organization. So within the LGBTQ community, this involves, for example, assumptions of heteronormativity, homophobia beliefs, where a person in the community is perhaps immoral or natural or sinful, and this can be religious based. Um, this is a phase type of belief where we just believe that this person, especially young patients, are going to grow out of these feelings, emotions, and we believe that it's more hormonal based than their actual self. Another example is stereotyping, which is a belief where flamboyancy or gender normal roles are what is acceptable in a relationship. Um, Also believing that this group or person is isolated or rejected, or assuming that they have a very negative lifestyle or view of themselves due to rejection of their family, being alone, because of a lifestyle that they chose. So these stigmas and discriminations can cause disparities in healthcare. So disparities between are seen when there is a noted difference in how they are treated. So this involves perhaps access in healthcare, quality in the care that they receive, and the outcomes of the care or treatments. So, different healthcare disparities that can occur in like different factions, for example, first and foremost, disparities can occur in preventative healthcare, access to healthcare or specific care needs that this group may need, and also mental health services. So first and foremost, we mentioned preventative healthcare. So stigmas and discrimination lead to avoidance of care and therapy. So patients or people in this group often have issues with trust due to stigmas and disparities and those actions against them. So they may avoid care because they are not feeling shameful, but just um, untrusting of the providers or people around them. So this leads to lack of screening and preventative measures. This can be on the provider end or the patient end. So providers may have their assumptions, and research suggests that LGBT community may be higher at certain risks, such as acquiring STDs, or any group that's really sexually active may have higher risk with this, especially those in the LGBT community. So screenings are important for all young people who are sexually active, and within the LGBT community, because of certain arrangements, providers may not be prescribing or ordering for STD screening. This leads to inadequate care for those patients. And also insufficient mental health care screenings. So, due to certain disparities or prejudice, the community is lacking those screenings for depression, anxiety, or suicidal ideation. Access to care. So, another way that they lack due to these stigmas and discriminations. So, lack of LGBTQ affirming providers is one issue that this community faces with access to care. So, there is lack of training for specific needs, such as transgender needs and follow-ups. And this can be due to those gender reassigning procedures. There are providers who are uneducated on how the procedures and follow-up care needs for that patient. Um, Intake forms that only list male or female, So this process excludes those who have chosen names or pronouns, and this may deter them from coming to the office, knowing that it will probably be a negative experience, and also a lack of anonymity. So a lot of patients coming to see providers may have specific needs, and are fearful of being outed, especially in rural areas. It may be a smaller town or something similar to that effect, and they just are not trusting of that provider because of the lack of affirming providers in the area. They also have a fear of mistreatment when it comes to care. So this kind of plays into that mistrust that they have or have experienced because of stigmas or just discriminations, bullying, harassment. So they fear that, they'll receive the same treatments in medical offices. This leads to avoidance of screenings or lack thereof screenings. For example, providers may hear certain sexual orientations and decide not to have those screenings done. For example, pap smears for females or vaccinations that can be done to prevent, hospitalizations and other complications. There's also assumptions of HIV or AIDS status. So this may lead to, looks or lack thereof care for lab work or urinalysis and other things that can be done in the offices or in laboratories due to an assumptions of a status. And there's also in certain states where there is the religious exemption, which allows them to deny care just based off, their lifestyle or how they look. There are also limited services in certain areas. So this also leads to limitations in access to care. In those limited services in those rural areas or other areas, insurance may exclude coverage for certain treatments, such as hormonal treatments, PrEP, PEEP for HIV prevention medications. And these are especially important in the LGBTQ community as time goes by, medicine and other procedures are being made available to them. And some of these insurances are not covering these treatments. And this leads to fewer offices that offer these services and clinicians that are even available to offer these services, especially in rural communities. Another aspect of care where we fall short in this community is mental health care. So there's a lot of mixed diagnosis within the LGBT community. Providers can easily overlook symptoms due to biases or lack of knowledge. For example, MDD versus gender dysphoria. The basis of these diagnoses may be very similar, but there are certain stipulations that are specific for these diagnoses. Providers or just workers who are helping these individuals may attribute it to that phase. Stereotype where they kind of just brush it off and say that they'll kind of get over it or work on it and be able to move past it when it could be something extremely medical that requires medication for treatment. And then also with my misdiagnosis, not only on the provider end can it be an issue, but on the patient end, a lot of times patients within this community may hide symptoms due to their fear of misunderstanding or mistreatment. Within the LGBTQ community, there are higher rates of certain mental health conditions, and it's important for the provider to be knowledgeable of this so that they're able to make accurate decisions with treatment and diagnosis. So, for example, depression, twice as likely for the LGBT community patient. There are a lot of suicidal ideation and attempts in the LGBTQ community. There are higher rates of this. Substance use disorder, the LGBTQ community have coping mechanisms that may involve drugs and alcohol, especially in the youth or young adult populations. And there's a higher rate of PTSD within this community as well for those who do experience violence or rejection from family. there are barriers to access and care all around, not just for the LGBT community, but it can be for them specifically as well. Even in like cities where their populace is high, there are limited psychiatrists and psychiatric mental health providers that service these communities, and there is a lack of training for those specific needs in the community as well. So there are ways of addressing healthcare disparities and stigmas here in healthcare. There are many things that, as future providers or current providers, that we can do to assist the community and their needs. But here's just three pointers that we can focus on. First and foremost is education. Provider education should definitely include a comprehensive training on LGBT community healthcare and mental health services. We want to be knowledgeable on every population we serve so that we can provide the best outcome for them. Healthcare environments. So we want to make sure in our offices or where we work that we are very inclusive to our patients. Intake forms should be inclusive to same-sex partners or parent households and non-gender affirming patients. So we want to make sure that they feel welcome even in those pre-healthcare screenings before they even see us. Public health service is a big one for this community and just in general for the population, especially in mental health. We want to make ourselves available for public health services and volunteer for patients who are unable to afford care or treatment or even make it to where we are. Public health services are often held in major cities, but they also can be held in rural areas. So if we can make it out there to support their needs, that would be wonderful service, and help close gaps in cares, especially for those in need in the LGBT community. And these are our references for this presentation. Thank you so much for listening.
Okay, Jamie, I'm going to um, take the file and upload it to YouTube and then send you an email so that you can post it as well.
Okay, thanks.
Welcome.
Awesome.
Bye.
All right, bye.